Substance use disorder is a silent epidemic that touches every corner of society. It affects individuals, families, and communities worldwide. The roots of addiction are often complex, stemming from genetic predisposition, environmental factors, and the specific effects of the substances themselves. Furthermore, potential for addiction significantly impacts the role of a substance. Drugs interact with the brain's reward system, flooding it with dopamine and creating a sense of euphoria or relief that users find difficult to resist. Over time, the brain becomes accustomed to this artificial stimulation, leading to tolerance, dependence, and ultimately, addiction.
Two categories of drugs known for their mind-altering effects are LSD and inhalants. LSD, or lysergic acid diethylamide, is a potent hallucinogen. Users place these squares on their tongue, where the LSD is absorbed into the bloodstream. The effects, often referred to as a trip, can last for several hours and are unpredictable. LSD acts on serotonin receptors in the brain, leading to profound changes in perception, mood, and thought. Users often describe experiencing vivid hallucinations, where colors seem brighter, sounds become more intense, and everyday objects take on dreamlike qualities. However, these altered states can also manifest as terrifying bad trips characterized by intense anxiety, paranoia, and disturbing hallucinations. The unpredictable nature of LSD makes it a risky substance. Even seemingly pleasant trips can be accompanied by physical side effects like dilated pupils, increased heart rate, and elevated blood pressure. While LSD is not considered physically addictive, its long-term effects can impact mental health and perception. One of the most concerning long-term risks associated with LSD use is the potential for hallucinogen persisting perception disorder, or HPPD. This condition, though relatively rare, causes users to experience flashbacks or recurrences of the drug's hallucinatory effects long after the drug has worn off.
Inhalants, on the other hand, are a diverse group of volatile substances found in common household products like glue, paint thinners, and markers. These substances are inhaled to achieve a quick but short-lived high. The effects are similar to those of alcohol, leading to disorientation, slurred speech, and impaired coordination. Inhalants are highly toxic and can cause severe damage to the brain, heart, liver, and kidneys, even with short-term use. The chemicals in these products can disrupt the flow of oxygen to the brain, leading to irreversible brain damage or even sudden death. The chemicals can damage the myelin sheath, disrupting communication within the brain. This damage can lead to a range of cognitive problems, including memory loss, difficulty concentrating, impaired judgment, and slowed thinking.
Perhaps the most widely used and socially accepted drug, alcohol, is a central nervous system depressant has a pervasive presence and addictive potential. Initially, alcohol can create feelings of relaxation by increasing the activity of gamma-aminobutyric acid, or GABA, a neurotransmitter that slows down brain activity. At the same time, alcohol suppresses glutamate, another neurotransmitter which leads to reduced excitability. This combination produces the calming effects and increased sociability people often seek. However, alcohol also stimulates the release of dopamine in the brain's reward system. Over time, the brain begins to rely on alcohol to trigger dopamine release, leading to cravings and dependency. However, as consumption increases, alcohol impairs judgment, coordination, and reaction time, increasing the risk of accidents, injuries, and risky behaviors. Long-term alcohol abuse can lead to a cascade of health issues, including liver cirrhosis, heart disease, pancreatic damage, and an increased risk of certain cancers. Moreover, alcohol dependence can have devastating social and economic consequences, affecting relationships, employment, and overall well-being. Alcohol withdrawal can be extremely uncomfortable and even life-threatening. Symptoms can range from mild anxiety and insomnia to severe tremors, seizures, and hallucinations.
Stimulants include prescription drugs like Adderall, as well as illicit substances like cocaine and methamphetamine. Stimulants flood the brain with dopamine, the neurotransmitter responsible for feelings of pleasure and reward. This surge creates a euphoric high, but over time, the brain adapts by producing less dopamine naturally. This leads to cravings, dependency, and the need for higher doses to achieve the same effect. The consequences of stimulant abuse can be severe, ranging from insomnia and anxiety to heart problems and even psychosis. Prescription amphetamines, such as Adderall and Ritalin, are used to treat conditions like attention deficit hyperactivity disorder. However, they are also widely misused for their stimulant effects. Amphetamine misuse can lead to anxiety, paranoia, insomnia, and even cardiac problems. Prolonged use can also result in tolerance and dependence, making it difficult to stop using the drug without experiencing withdrawal symptoms.
Cannabinoids found in cannabis include compounds like THC and CBD. While CBD is often marketed for its potential therapeutic benefits, THC is the psychoactive component responsible for the high. Cannabis use, especially high THC products, can lead to dependency. Long-term misuse can impact memory, decision-making, and emotional regulation. Some cannabinoids show promise in medical contexts. Recreational misuse carries risks, particularly for young users whose brains are still developing. CBD, or cannabidiol, is generally not considered addictive. Unlike THC, the psychoactive compound in cannabis, CBD does not produce a high or lead to dependency in the same way. Its mechanism of action involves interacting with the body's endocannabinoid system, particularly CB1 and CB2 receptors, as well as other pathways like serotonin receptors. These interactions are thought to contribute to its potential therapeutic effects, such as reducing anxiety or inflammation. It is worth noting that while CBD itself isn't addictive, some individuals might develop a psychological reliance on the calming effects it provides. This is more about habitual use rather than chemical addiction. THC, or tetrahydrocannabinol, is the psychoactive compound in cannabis responsible for its high. Its addictive potential lies in how it interacts with the brain's reward system. THC binds to CB1 receptors in the brain, which are part of the endocannabinoid system. This system regulates mood, memory, and pleasure. When THC activates these receptors, it triggers the release of dopamine, a neurotransmitter associated with feelings of reward and pleasure. Over time, repeated use can alter the brain's natural dopamine production, making it harder to feel pleasure without THC. This can lead to cravings and dependency in some individuals.
Opioids, including prescription painkillers like oxycodone and illegal drugs like heroin, are highly addictive substances that have fueled a global crisis. Opioids bind to specific receptors in the brain and spinal cord called mu-opioid receptors. This interaction blocks pain signals, providing relief. But it also triggers the release of dopamine, creating intense feelings of pleasure. Over time, the brain adapts, producing less dopamine naturally, which leads to cravings and dependency.
Nicotine, a substance found in tobacco products that's highly addictive and widely abused. Despite its prevalence, many people underestimate the risks associated with nicotine dependency. When inhaled, nicotine rapidly enters the bloodstream and reaches the brain within seconds. There, it binds to nicotinic acetylcholine receptors, triggering the release of dopamine, creating a sense of pleasure and relaxation, reinforcing the desire to use nicotine again. Over time, the brain adapts, producing less dopamine naturally, which leads to cravings and dependency. The consequences of nicotine abuse are serious, ranging from lung and heart diseases to increased risk of cancer.
Substance use disorder rarely has a single cause. It's often the result of a complex interplay of factors, making some individuals more vulnerable than others. Genetics plays a significant role. Research shows that addiction can run in families, suggesting that certain genes may predispose individuals to substance use disorders. Environmental factors also play a role. Growing up in an environment where substance abuse is prevalent, such as having parents or peers who use drugs or alcohol, can significantly increase the risk. Early life experiences, particularly trauma, abuse, or neglect, can also leave lasting scars that make individuals more susceptible to addiction. These experiences can disrupt brain development and coping mechanisms, making it harder to resist the allure of drugs or alcohol as a way to numb emotional pain.
Treatment and support for substance use disorder begins with seeking help. Quitting nicotine involves tackling both physical and psychological dependence. Nicotine replacement therapy, like patches or gum, and prescription medications can ease withdrawal symptoms. For alcohol abuse, treatment often starts with detox under medical supervision, especially for severe cases. Medications like naltrexone or acamprosate can help reduce cravings. Therapy, such as cognitive behavioral therapy, CBT, and support groups like Alcoholics Anonymous play a critical role in long-term recovery. Abuse of inhalants often requires behavioral therapy focused on breaking psychological dependency. Treatment may also address underlying mental health concerns, as inhalant abuse often stems from emotional distress. While hallucinogens typically cause psychological rather than physical addiction, therapy is crucial to address misuse. Treating opioid addiction often involves a combination of medication-assisted treatment, MAT, using methadone, buprenorphine, or naltrexone, and therapy. MAT helps manage cravings and withdrawal, while counseling addresses the root causes of abuse. Dependency on cannabis is typically treated through behavioral therapies such as CBT or motivational enhancement therapy. For stimulants like cocaine or methamphetamine, there are no approved medications yet, but therapy is key. Contingency management and CBT can help individuals break patterns of abuse. Addressing co-occurring mental health conditions is often part of the process. Substance abuse affects millions of lives, but recovery is possible with the right treatment and support. Recovery is a journey, and each individual's path is unique. Support from professionals, family, and peers can make all the difference.